right? He is in control. Got it. And Psalm 113 verse 9, it says, He maketh the barren woman to keep house and to be a joyful mother of children. Praise ye the Lord. So these are promises. And this is what the Lord wants from us, especially who desires a child, right? So what is infertility? In general, infertility is defined as not being able to get pregnant or conceive after 1 year or longer. Well, after 1 year. So if you're trying to get pregnant within a year, have patience. Have patience, because within a year, as the months go by that you're trying, it increases the probability of you getting pregnant, right? And after a year now, you start thinking and you're like, okay, maybe something is wrong that I need to fix. So because fertility in women is known to decline steadily with age, some providers evaluate and treat women aged 35 and older or after 6 months of unprotected intercourse, right? So you are not alone. So it says that about 12% of women, which is 12% of 7.3 million, in the United States, aged 15 to 44, had difficulty getting pregnant or carrying a baby to term in 2002. 10 to 15% of couples in the US are infertile, right? So this is an issue. This is an issue. All right, so factors that increase the risk of infertility. All right, so Brother Omar, I don't know if you got my message. This major one is infertility. Sorry, vaccination, which leads to infertility. And I must say that when I saw this, I was upset. I couldn't hold back the anger. I was extremely upset because, having had certain experiences and having known women who have experiences of miscarrying, I just could not hold back myself when I saw this video. So I'm gonna stop sharing so Brother Omar can share and let me know if you're having any issue.
As a gynecologist, in the last few years, we have seen a dramatic increase in the number of women who are losing pregnancies, the number of women who are presenting with threatened abortion, with bleeding in early pregnancy. We also see a lot of young couples with infertility.
Infertility is one of the most major problems now in gynecology in Africa.
Levels of anti-HCG antibodies, then the woman would actually just become sterile.
But how does a woman develop antibodies to HCG? Effectively, an autoimmune disease where the body is attacking itself. This was the question that was asked and answered by vaccine developers seeking to create an anti-fertility vaccine on behalf of the World Health Organization, starting in the early 1970s. This research and development program was undertaken in response to perceived overpopulation.
From 72 to 92, they spent 20 years funding the research for development of that vaccine.
These facts are indisputable. WHO, through its task force on vaccines for fertility regulation, has been supporting research on a synthetic vaccine against the HCG molecule. In order to immunize a woman against getting pregnant or abort a successful pregnancy, scientists discovered that physically combining the beta subunit of HCG with the tetanus toxoid used in the routine tetanus vaccine was the most effective approach. Not only did the woman develop antibodies against tetanus, she also produced antibodies against HCG, including that produced by her own body. But inevitably, an anti-fertility program faced challenges. Despite support from Kenya's leaders and what were described as elite.
As a gynecologist, in the last few years, we have seen a dramatic increase in the number of women who are losing pregnancies, the number of women who are presenting.
Thank you so much for ably sharing screen. So just wanted to explain what just happened on this, what was just shown. All right, so the tetanus vaccine, and us here in Jamaica, we have what is called the DPT vaccine. It's scheduled in every child's immunization, right? So it's a part of the immunization program here in Jamaica, many Caribbean countries, and in Africa. Now, what happened is that the DPT was actually a vaccine that was developed to help with population control. So when a woman is pregnant, you have a hormone called HCG, which is human chorionic gonadotropin, right? And that hormone, that's what you use. That's what reacts with the pregnancy test. So when you take a pregnancy test and you see the red, it's something that is in the pregnancy test, reacts with the HCG, and it becomes brighter as the pregnancy develops. Now, women who have experienced miscarriages would have seen where like you are tested, you get a positive result, right, from the pregnancy test, and a couple weeks after, you see the color of the HCG, or the color of the pregnancy test, it's no longer bright red, but very, very light red. And this is because the DPT, which is a part of our regular immunization schedule, they laden it with anti-HCG antibodies. So what happens now when you're pregnant as a woman, and the HCG level would raise, which is your the regular hormone, right? It would rise. The body attacks it because they have anti-HCG antibodies from the vaccine. So in essence, you can't get pregnant. Well, you get pregnant, but you can't keep the baby because the hormone, your body attacks the hormone that would have helped in the development of, or the process of childbirth, right? So when I heard this, when I saw this, I was upset because I'm like, they schedule it in for every Jamaican child, or some Caribbean countries, they schedule it in our regular vaccination routine. Some women who have gotten it when they're infants, their bodies would have been a little bit more resilient, right? So you can get pregnant. However, even in the process of getting pregnant, you would have had some miscarriages, whether you know it or not, because most miscarriages happen at 6 weeks. And at 6 weeks, most women think that the flow is late, right? So most women, it's late, but it will come, and then afterwards it comes. But actually, you were actually pregnant, right? But you would have had a miscarriage. Yeah. Because of something that is scheduled in our regular immunization program. Go ahead, in-house.
Okay, I just have a hand up here. Just to, just clarify it some more.
Yes.
Each person just need to seek informed consent. If you're about to do that to your children or your child, just seek informed consent. And informed consent means you get the ingredients, a leaflet or something of some sort telling you of the constituents of whatever pharmaceutical agent you're about to get, okay? So in this case, what they found is that some of them had beta HCG, all right? We're not saying that all of the batches had that. So you need to check. and see if that is so. Because once it has beta HCG, your body produces the antibodies against HCG, and that prevents you from carrying any pregnancy. We don't know if it happens in every person, but the possibility is very strong.
All right, so let me go back to sharing screen. All right, so another factor is age. So persons over 35, you have less eggs, right? So it's good to have children under that time. However, if you if you abide by the 8 laws of health, and some other things that I'll discuss, then of course you can still have children over 35, but you have less eggs, so it's good to have children under, right? Stress level, increased cortisol levels affect other hormones. So if you're stressed, if you want to have children and you're stressed, or you're continuously in a stressful environment, you may have miscarriages or just won't conceive. I was giving the example of my cousin. She fell out of a tree, fell on steel. She fell on steel. Yes, it was very, very, oh Lord, that was a gruesome scene. And the steel damaged a part of her uterus, right? And for years she was trying to have children, and she was always stressing over it because she really wanted to have children. And when she found out when she was pregnant, when she stopped thinking about it, she thought it was impossible and everything. She stopped thinking about it, and then found out that she was pregnant when she was actually 7 months pregnant, right? So stress does affect pregnancy or cause infertility. Go ahead, Kenny.
Yeah, I was just also adding that, and that's a natural response of the human body. I mean, if you're in a stressful situation, it's not time to have a baby, so different bodies react differently, and some of them react on the reproductive system. Some stress hormones react more heavily on the reproductive system than others, because some women are so stressed and they still get pregnant. Mm-hmm. While for another woman, a little stress is what makes the difference.
All right, so poor diet, nutrition deficiency, right? So ensure that your diet is well balanced. Also, ensure that you don't have you're not taking in food with caffeine and some other growth hormone related substances, like food from animals, milk. We know that cow's milk have bovine growth hormone in it, and that can affect so many other things that can cause growth of the fibroid. You have fibroid growth and you have other growths, right? As well as dairy products and meat. You can cut off those with advice from professionals, right? All right, so smoking or being around smokers, that can affect that. Alcohol intake, that's why we as Seventh-day Adventists, we know that we shouldn't take alcohol in the body. I don't know if everybody would have signed a pledge card before you got baptized, promising to abstain from certain things, and they show the reason why and stuff like that. But alcohol, it does affect your chance, or it reduces your chance of getting pregnant. Infections left untreated, right? So if you have a bacterial vaginosis, or you have a yeast infection, whatever infection left untreated, are infections from STDs like chlamydia and gonorrhea. And chlamydia, I think it's asymptomatic in men, and sometimes it's asymptomatic in women as well. So you won't know. So it's good to get tested as well. Caffeine intake, and as Sister White says, I realized that many persons, even Seventh-day Adventists who would have known about caffeine and stuff, because you're tired, you're going, you just feel like, okay, I would just have this now, or, but caffeine, it says the action of coffee and many other popular drinks is similar. The first effect is exhilarating, right? The nerves of the stomach are excited. These convey irritation to the brain, and this in turn is aroused to impart increased action of the heart and short-lived energy to the entire system. Fatigue is forgotten. Of course, we feel energetic, but the strength seems to be increased. The intellect is aroused and the imagination becomes more vivid. By this continual course of indulgence of appetite, the natural vigor of the constitution becomes gradually and imperceptibly impaired, right? So, of course, leaving off caffeine out of your diet is something that we should do. Let's give me issues.
So Shrees, I have a question. So what about people with like some conditions, blocked tubes and so on?
Yes, I'm gonna go there.
Okay, great.
Yes, I'm gonna go there. Thank you. All right, so common causes of infertility. So severe endometriosis, and a lot of women suffer from endometriosis, right? Pelvic inflammatory disease. So this is when the organs for reproduction, they become inflamed. Ovulation disorders, and this is because of the hypothalamus in your brain. It needs some rejuvenation. I mean, persons give hormonal therapy, this therapy, that therapy, but the hypothalamus is just crying out to say, hey, give me some attention right here, right? Polycystic ovarian syndrome, PCOS, you have early menopause, benign uterine fibroids. Yes, we have fibroids, as I was saying before. If you the reproductive organs are for growth. So if you're feeding them with growth hormones that are found in meat, in chicken, and meat and stuff, as well as in milk, cow's milk especially, growth will occur. But is what type of growth? You have uterine fibroids, right? And you have pelvic adhesion. So because you have physical obstruction. So sometimes when you do a hysterosalpingogram, when you do that, Kenil does that. So I want you to just come in and share what you have seen in terms of the rise in the amount of HSGs that you have been seeing now.
We live in a time where people have more access and more willingness to come for medical procedures and treatment. So you have more people turning up. But you see a lot of people in their early 20s, mid-30s with the same complaint, infertility, sometimes subfertility. But basically, the studies where you just look at the fallopian tubes and the uterus to make sure that there is a clear passage and that the shapes of them, is fine. And a lot of times, wow, you see some things that shock you. Uterine fibroids push it way out of shape, it's bent out of shape. And in most cases, one or both fallopian tubes are blocked. And then in some cases, there is no reason why, there is no apparent structural reason why the person cannot get pregnant. But for most times, it's a blocked tube.
Okay. Thank you for sharing that, Kenya. Right, so these are some physical obstruction, uterine fibroids, Kenya mentioned before. Endometriosis, can you share with us your endometriosis experience or the experience of a patient that has endometriosis?
Yeah, the endometriotic tissue got into the lungs and started bleeding menses, just like how a woman would bleed on a monthly basis. So this person had what we call a hemothorax due to endometriosis, and the amount of blood that it was a procedure that, just punctured the lungs gently and got out some of the blood. And my goodness, it's like a butcher shop, the amount of blood that came out. So whatever you can do to cut down on the hormones, just really do it, ladies. Really do it.
Okay.
So a mid-30s lady, by the way.
Wow.
Yeah.
All right, so endometriosis is where the same cells on the lining of your uterus that sheds and you have a period at the end of the month or menstruation. That lining actually migrates to different parts of the body. So it can migrate to your lung. It can migrate in your on your colon. And sometimes during that time of the month, you see bleeding through your rectum. It's not really rectal bleeding, but maybe it can be due to endometrial tissues in the colon or along the alimentary canal. You can have bleeding. So they basically migrate to other parts of the body. And during your time of the month, the bleeding occurs sometimes, and it's painful and it creates scar tissues. Once I had a lady, she came to me and she said that she has endometriosis. Okay, she has endometriosis. And I just told her to come off meat. If it's and sometimes you're like, why would you tell someone to come off meat? If you're experiencing that level of pain and discomfort, if you're bleeding through your rectum, if you almost suffocate because you have bleeding in your lungs, then it means that you just need to come off something that is affecting you. And she came off it within within 3 months of her coming off flesh meat, the endometrial, she said that she experienced just normal pain, normal period pain, right? Bleeding stopped because when you have bleeding, your stool is black or red, So all of that, the symptoms drastically decrease. Right, so just come off and get substitutes. What are the substitutes? You have your beans, the different varieties. You have your vegetables. Substitute. Just get off them. You have roots and stuff, right? So ways. That's the number one. You can also do a lymphatic cleanse, and I tell everybody you need to just do a cleanse. Everybody needs a cleanse. You have pelvic inflammatory disease, right? So the endometrium, that's the lining of the uterus that sheds, it just becomes inflamed. Salpingitis, which is you see over here, this is the normal. Over to the left is the normal tube and the normal ovary, right? Over to your right, you see the tube is inflamed. And of course, most times the inflammation is due to our diet, right? Our diet, or in some infection that we have that is not treated, or STD, right? And you have inflammation, you have tubo-ovarian abscess. And look over to the right of the screen. The tube is swollen and the ovary is kind of swollen too, right? So the struggles are real, guys, and so we have to ensure that we are doing our parts in abiding by the 8 laws of health. When I went through how you can help, I don't want to say cure or reverse, but how you can increase your chance of getting pregnant, the eight laws of health is just popping out, right? You have fibroids. I remember this girl in college, she was 17 at the time, and she had, I think it was around 6 huge fibroids. 17 huge fibroids. So why are young children getting fibroids? Because of what we eat. We're feeding it with them with growth hormones. We're giving them the formula that is laden with milk from their young. And so when they reach 16, 17, and of course the age is decreasing, no, going down, maybe 11, once they hit puberty, you start to little fibroid growth. All right, so my timer is here, I have 6 minutes. All right, so I'm gonna zoom in. So if you don't have any physical blockage, you may have hormonal issues where something is wrong with the hypothalamus, right? So you can increase your chromium intake. You have broccoli, potato, garlic, basil, orange, green beans, apples, bananas. They are rich in chromium. You use essential oils. So frankincense and myrrh. Yes, that essential oil is very, very good for the brain. So you can do that. Vitex, or also called Dong Quai. Chasteberry, sorry. Vitex or chasteberry, that is very, very, very good for stabilizing female hormone. Eat healthy fats, right? Like your olive oil, coconut oil, and you don't fry things in them. You actually just sprinkle them on your vegetables or what your food, so you can get the fatty acids, right? Get enough sleep and reduce stress in your life. Exercise regularly. Don't over-exercise. When you over-exercise, it reduces your chance of getting pregnant, right? So go on a total cleanse. Colon first. It's good to cleanse your colon first, because if you cleanse your liver before your colon, all of the stuff in the liver will just lodge back in the colon and stay and go back in the body. So colon first. And when you're doing a colon cleanse, sometimes the worms go too. So you have a colon cleanse, the worm cleanse, the liver/kidney cleanse. Colon cleanse, you can use, I like aloe vera. You can use psyllium as well, psyllium powder. Worm cleanse, you can use the papaya seeds. Go and look up how to do it. Don't be like Kenil and blend up a whole heap of papaya seed and drink it, and then he was just burping because he overdosed himself.
Come on,
sorry,
try
but
it
we
there.
had a lot of guests that day. So papaya seed, the aloe also helps with the worm, but if you don't want to see them whole, you use the other things, right? Liver or kidney cleanse, heavy metal cleanse. Ensure you do your heavy metal cleanse. You can use busy, you can use charcoal. Your lymph cleanse as well. When you're doing colon, especially I like aloe vera because it cleanses the colon, the liver, the kidney, and the lymph. So that's why I'm a huge fan of aloe vera, right? So I'm almost finished, Kenil. I'm almost finished, Tanisha.
I wanted to ask a question about, I hear this thing called dog blood.
Yes. Okay, so go for a piece, Kenil, for me. Preferably one with the berries. So you have dog blood. It is an amazing herb, and it is known to unblock the tubes, right? So as you said, that most females that comes in for histosalpingogram has blocked tubes. So the dog blood, I don't remember the scientific, or inflammation weed, what we call inflammation weed, that is very good to unblock the tubes, right? All right, so we spoke about that earlier before waiting on Kenny. We spoke about that. So eat a nourishing diet. Be sure to supplement it with sufficient vitamins and minerals. Thank you so much, Kenny. So this is the dog blood with the little, let me know if you're seeing it. The dog blood with the little red berries. Are you seeing it? Please let me know.
Go over to your left a little. Yes, come down a little bit. Yes, there you go. Yeah, we're seeing it.
Yeah, so this is a dog blood, a little berry.
Right, I'm putting in a request. Since you guys live in a country and you have a lot of it, I'm putting a request for some. Is that okay?
Oh, yes, man, sure.
All right.
Sure.
As soon,
Sister Tan?
yeah, as soon as possible.
Yes, I put some in some pots. So I'm gonna just dig them and form some little different pots. And of course, I'm gonna, because it's very, very good. So inflammation weed, right? So it actually unblocks the tubes, and the inflammation that is caused due to pelvic inflammation disease, it also helps. So that's amazing.
Yeah.
All right.
We've had many success stories with it, you know.
Yes, go
Yet,
ahead, Kenny.
yet anecdotal. We don't have it scientifically listed, but we have a case where people couldn't, and they just went on this thing for about 2-3 weeks, and they had afterwards, you know.
They had children.
Yeah, of course.
So dog blood or inflammation weed, you need to get some of that. It's not only for blocked tubes, you know,
Yes,
but
right.
it's inflammation overall, which we all suffer from, right? A deficiency in psyllium can lead to infertility in women. So it's good to psyllium. Vitamin E is very important if you wish to conceive. So write down the vitamin E, because you need to share this with your friends and so on. So vitamin E is very important if you wish to conceive. You have PABA, is a B vitamin which stimulates the pituitary gland and sometimes restored fertility to a woman. Wow.
Oh, wow.
Right? So para-aminobenzoic acid. So it's in the B vitamin. Do you know bee pollen? Bee pollen is rich in a lot of B vitamins, or you can just get your supplements, right? So test for food allergies, because sometimes you have food allergies which causes inflammation, especially the milk. It's very, very allergenic. Avoid white flour. Sounds like health reform, right? White flour, fried food, sugar, junk, and caffeine food. Do not eat animal fats. Right? So avoid all of those. Gluten-free diet. Ooh. Oh Lord. This thing is going on me and I'm almost finished. Okay, so avoid. Okay. A gluten-free diet has enabled women who previously were unable to conceive to become pregnant. So we hear about the psyllium, we heard about the PABA in vitamin B, we heard about the vitamin E, right? We're now looking at gluten-free meals. If you're smoking, you stop smoking. Avoid caffeine and medicinal drugs. Yes, medicinal drugs. Caffeine can prevent pregnancy from beginning. That's how caffeine is. And you're wondering, so how some persons feed on coffee and gets pregnant. But the thing about it is that how will that affect their girls? How will that affect their daughters? Remember the Pottinger cat study, which found when the meals that they had affected the third generation, a lot of diseases occurred, and by the fourth generation, they were infertile. So it does affect what you do now affects your children. It doesn't have to directly affect you now, but it affects your children. And some persons, unfortunately, it affects you now. All right, so avoid, there is a possibility that you have had heavy metal poisoning. So remember I said earlier, get a heavy metal cleanse. Just do a total cleanse. I have a document called a total cleanse. I can share it in the group, in the CFMI group, so everyone who is invited on here can be sent to them. A total cleanse. So women who drink alcohol can prevent implantation of the fertilized egg in the womb. Helpful herbs include black cohosh, red clover, yellow dock, wild yam, chamomile, skullcap, I've never heard of that one before, and dong quai. Can I share my story, Kenny? My wild yam story. So wild yam, I remember when we went to a camp meeting. I think is the same, is old part, the camp meeting. Was it in St. Anne? Yes, and I bought the wild yam. At that point, I found out I was pregnant with Micaiah. and was home and just started like bleeding. And I went for the wild yam, prayed and everything, and the bleeding just stopped, right? And at that point I was fretting and everything because that was some heavy. And the wild yam took the wild yam and it just stopped. So I started drinking the tea. And of course, the Lord has kept my pregnancy. And, the use of the herb that he provided also helped. All right, amen. So, and dong quai. So if you want to get pregnant, you can start boosting up, feeding your uterus with the black quash, primrose. Primrose is not on here, at least I don't know what it is. Primrose, Vitex or chasteberry, that helps the hypothalamus. Yellow duck, you have wild yam, you have chamomile, you have dong quai. Black cohosh balances the hormone. You have false unicorn, which is another herb. You have wild yam, dong quai, it helps to increase fertility, all right? The use of natural progesterone cream has helped many women become pregnant, because sometimes it's not a case of anything else but the fact that your body is not producing the progesterone to actually keep the wall. So the fetus is good, but the wall, it just keeps breaking down. They call it subchorionic bleeding. Yeah, it just keeps breaking down. So the progesterone cream helps. So you rub it on the abdomen. Avoid stress. Remember, the cortisol level increases and causes miscarriages. The closer a woman's weight is to the ideal, the more likely she is to conceive, right? So when your BMI is under 18.1, you are underweight, and it's a less probability of you conceiving. And when you're overweight, it lessens the probability as well. Do not exercise too much at the time. It can, in some cause a skipped ovulation or increase infertility. So if you want to get pregnant, don't go on and over-exercise. Do light exercises so that you can keep healthy, but don't over-exercise, all right? All right, so I'm almost through, Sister Tan. Thank you for the extra time. Yes, it's just, I just wanted to finish. It said, avoid hot tubs and saunas, for they may cause changes in ovulation, right? Remember, ovulation time, your body is a little warmer and you don't want to get it too hot, right? So that do not douche. Where you go again? Yeah, do not do that. It can interfere with vaginal pH. Beware of commercial douches, lubricant gels and stuff. So normally when females, you get a yeast infection or something, the douche, which is you sit over the water maybe with salt and vinegar, and you get a little steam, and you have commercial I don't remember the pronunciation, right? So don't do that if you're trying to get pregnant. Use egg whites instead of petroleum jelly. Petroleum jelly might kill the sperm. So if while doing your thing, so the egg whites may help them in their journey. So if you want lubricant, use egg white and not petroleum jelly. Only use egg white during the few days each month when the woman is fertile. Egg whites are pure protein. A study in Canada found that it was the best lubricant to use in conception, if conception was desired. Take the egg out of the refrigerator earlier so it will not be cold, and separate the yolk from the white. All right, so I've learned something new. So egg white you can use as a lubricant if you're trying to get pregnant. Do not work so hard that you are fatigued. It is well known that people who go on a vacation trip are more likely to conceive. They have more time to relax and rest up. And of course, the laws of health, rest, right? Ensure that you're getting your rest. Make sure you time it just right. So your ovulation time, when ovulation occurs, a lot of changes happening in the body. Your temperature increase, females, yes, a lot of things. All right, so check out how you would know that you're ovulating. The woman should remain lying down for 20 minutes after ejaculation. So you put your foot up and you 20 minutes so that it ensures that the connection happens, right? If a woman has developed antibodies to her husband's sperm, avoid releasing sperm for a month, right? This should cause the sperm antibodies to decrease. Okay, so sometimes the woman develop like after ejaculation, the body has antibodies which actually want to kill the sperm, so it would never reach to the egg, right? So it says that how you go around that is just not continuously. If you do that first and you realize that's the issue, you would kind of not do it for a while until the antibodies decrease. There is always risk if you give consent for a physician to do fertility tests inside your body. So there's always a risk involved in damaging something or so. All right, so that is my presentation. Thank you for the extra time. I don't know if we have time for questions, but I hope this added value, and you'll get the presentation in the group as well. Let me look in the chat. How do I do this one? Sister Tan, I don't know if we have any time for questions. Well, I'm gonna just look in the chat. For the aloe vera, do you just eat the gel? And how often do you take it? Okay, so for the aloe vera, I blend everything from the biblical perspective of what God has joined together, let no man put asunder. The outer part is good as well. So what I do is wash it and cut it up and blend it, strain it, and then I drink 2 tablespoonfuls twice a day. So in the morning and in the evening. And it's best to do it before you, not on an empty stomach. So during meal, you have it, right? Because it drops the glucose level. Is wild yam good? Is wild yam only good for persons with inflammation issues? The wild yam is a natural progesterone, right? So it causes the uterus lining to stay, especially if you have a good, a viable fetus. So it causes it to stay and not shed while you have the fetus, right? That's what I know it to do. Oh, not wild yam, all the herbs you mentioned. Yes, some of the herbs, they have different mechanisms. Some is for inflammation, some is to keep, to help like Vitex is to help the hypothalamus. If inflammation weed is to unblock the tube, so they have different mechanisms of action. Okay, use coconut oil, cold pressed coconut oil. Okay, thank you. And the laws of health is nutrition, so proper nutrition, exercising, not over exercising, water, drinking lots of water, getting sunshine at 10 minutes in the morning, temperance, be temperate in all things, right? Pure air, rest, and trust in God. Trust that God will fulfill his promises. All right, and the inorganic soil is a problem as well. Yes, any form of GMO will affect infertility. So I hope this helps. Can you take while you're pregnant? All right, I would say do it with a physician's help. If your pregnancy is okay, but I wouldn't say you should continuously take William while you're pregnant, right? Because herbs based on the trimester, you only use herbs during pregnancy if there is an emergency. All the herbs that I mentioned before should not be taken only for emergency purposes, but you should take it, give your body like a month, 2 months, 3 months, based on the miscarriages that you have been having. So if you have 2 or 3 miscarriages, give your body like 3 months, and you feed on these herbs based on the recommended dosage, of course. You drink these herbs, you do your cleanse, you rebuild back your body, you ensure that you're feeding the hypothalamus, right? And it's like you're building back your body. And for the vaccination purpose, there is this herb called St. John's wort, but you have to study about it. You cannot take it with any other form of medication. If that's what you're taking, that's what you're taking. No other medication you can take it with, right? And that will help in terms of taking away whatever medications that would affect. So all the medications that are there lying around in your body, that it would have been affecting you, the St. John's worts will help to clear those out. But you cannot take it with any form of medication because you will have severe anaphylactic shock, right? Or needles in your throat. You'll have some allergic reaction. So for my family and I, because of COVID-19, we didn't take the vaccine. However, because we got the virus, we're clearing the virus from our system using that herb. We have many other herbs, but we're using that herb, all right? No, that's a totally different topic. I don't want to take up any more time.
Yes, please. Yes, please.
All right. So I'll send you a message and let us pray and then to close. Our God and our Father, thank you so much for your many blessings. And we pray, dear Lord, that this will be beneficial to someone on here who has been going through the pain of not conceiving or the pain of miscarriage. Lord, I pray that firstly they will have godly trust in you, knowing that no matter how much herbs we take, if we don't trust in you, dear Lord, if we don't trust in you and make you our arm, Lord, nothing will work. So Lord, I pray that you will help us to take hold of your promises and take hold of what you said that we should do, which is the use of natural, simple remedies. Thank you again for all that you do. In Jesus' name I pray and give you thanks. Amen.
Amen. Amen.
Right, back over to you, Sister Ann.
All right, thank you. So I'm a person of precise and precision timing, but this topic, Sister Shreese, I believe was one that we needed to hear the entirety of because so many women are suffering from this. And I have a friend who had a miscarriage recently. So it was a topic that needed to be, to go to its completion. So thank you for being pressed to present that to us. So before moving on to our musical item, Pastor McFarlane have a few words for us. Pastor McFarlane, go ahead, please.
All right, thank you so much, Sister Tan. We're on the road, heading out to our destinations for today. Just saw the Nelsons, Sister Sasha, they're on their way to St. Elizabeth. We'll be meeting up there a little later. All right, but just to say happy Sabbath to everyone and welcome Sister Shreese, a big subject today. I think a very important one, necessary one. And it was really a gripping presentations, and we want to thank you for that. Quite a number of persons that may be on for the first time. We want to say welcome to our Zoom platform here at CFMI, and we trust that you will have a wonderful, wonderful day. Just like to point out at least two of our visitors. I am seeing a Mrs. McDonald connected. Is this Mrs. Arita McDonald? Please open your mic and let me know.
No.
Mrs. McDonald?
Yeah, you heard me? No, it's not.
Yes, I'm hearing you.
Aretha no, this is Ciamara McDonald.
Oh, sorry about that. I didn't get that.
It's Ciamara McDonald.
Okay, all right. I thought it was a Mrs. Arita from Keys. All right, to have you, Lady Mac, and all the other persons who are on today. Tanner, I'm seeing you connected. How are you, brother? Tanner has been joining us for quite a few weeks now, and we're happy to have you on as well. Everything is all right, Brother Tanner?
Yes, everything's good. I don't know if you can hear me. I'm using my headphones right now.
Yes, I'm hearing you. I'm hearing you well. All right, welcome and continue to enjoy the program. I know you're going to be welcomed by Sister Brown in a special way today, so I'm not going to do any more. Welcome, everybody. Have a wonderful program and catch up with you a little later. God bless. Thank you, Sister Tan.
All right, Pastor McFarlane, you're welcome. All right, so moving on. Next, we have a musical item by Sister Trish Fagan, and then following her, we have our Sabbath School by Elder Keith Fagan.